Welcome. This is NCLEX Prep 2.0. Here, we make nursing school simple and help you pass your NCLEX. Let's talk about the ethical principles of nursing, or if you like, nursing ethics. Autonomy. Think about this as giving your patient independence to make their own decisions. That means even if you don't agree with it, we do not force anything on a patient. If they refuse a procedure or treatment, educate them on why the procedure is important, and if they refuse, you let them. And document in their chart that patient refused X, Y, and Z. Beneficence. As a nurse, we take oath of allegiance to advocate and act in the best interest of our patient. For instance, if the patient is in pain, we act by doing interventions to stop or alleviate pain by, for example, repositioning or contacting the doctor to request for more effective pain medication. Justice. As a nurse, we are supposed to be non biased during patient care. We care for our patients without stereotyping or bias, either by based on race, gender, sexual orientation, or even insurance status. Non maleficence. Do no harm. A nurse avoids causing harm to patients, for example, by performing checks to prevent medication errors or by not administering a medication that the patient is allergic to. Veracity. I remember this with this quote Vera is honest. So, veracity, honesty. Vera is honest. Veracity is all about honesty. A nurse is expected to be honest with the patient with anything that pertains to their care. For example, a nurse honestly informs a patient about the potential side effects of a new treatment, even if they may not go with this treatment. So, we do not downplay our patient. Fidelity. You must deliver on every promise you make to your patient. If you say, I will be coming in to check on you every hour, you will do just that. Otherwise, the patient will not trust you. Accountability. It's all about taking responsibility of your actions, good or bad. For instance, if a nurse mistakenly mixes up medications, they take responsibility by discarding the incorrect vials and getting new ones instead of administering the wrong medication. Confidentiality. This is all about HIPAA. This has to do with keeping patient information private and confidential. You only share the patient's details with those who are directly involved in that patient's care. For example, if your nurse bestie is asking you about what happened to your patient, you do not disclose because they are not involved in direct care of your patient. In regards to patient's family, you only disclose information to individuals your patient has given rights to. If the wife is the patient and they choose not to disclose any information or particular details to their husband, you owe them that confidentiality. You will not disclose that information to the husband. If you are conflicted, take it to the ethics committee. Thank you for listening. Please subscribe, like, and share with your friends. Help me grow this channel. See you on the next one. Bye.